Hi, this is my final video for therapeutic modalities. In this video, I'm going to be demonstrating how to properly apply e-stim and massage depending on a particular injury. So for this injury, this is a male OU gymnast, and he has a pectoralis major strain. It's about 4 months old, but he's still struggling to regain his strength. And so because of this, I'm going to use neuromuscular electrical stimulation, and then I'm going to follow that up with different techniques for massage. So with neuromuscular electrical stimulation, I chose this because it will help increase or decrease neuromuscular inhibitions, increase blood flow, reduce pain, and reduce muscle spasm. But then some contraindications for this specific, for e-stim treatment is if you were to have a pacemaker, if you had any kind of heart conditions. I also wouldn't want to use it over the heart or the brain. So with pectoralis major strain, I want to be careful about where I place the electrode, so I don't place it over his heart. I also don't want to place it over any unhealed fractures that just recently happened. But he doesn't have any of those, and I would make sure I would ask him that before I got started. And then I also wanted to be careful with areas of impaired sensation, skin lesions, an area of decreased range of motion, and then any extensive torn tissue. So then going off with that, the pectoralis major is a large fan-shaped muscle of the chest. It aids in adduction, medial rotation, and then it also transversely adducts the arm at the glenohumeral joint of the arm. And so in order to test this athlete for his strength, I would just manual muscle test him. I probably would have already done this by now because he's about 4 months out, and he's still, even though he's still competing, he's still struggling to be back at his typical performance. So I could just manual muscle test him by asking him to bring his arm into adduction, and I could just restrain him, testing his muscular strength. And so I decided that I'm going to use e-stim and massage after going through manual muscle testing and going through different treatments in the past that haven't been working for him, and I made sure that he didn't have any of the contraindications that I listed previously. So anyway, to start my e-stim treatment, I would lay him down. I could either lay him down in the supine position or have him elevated, but I'm gonna have him supine, laying comfortably. I would want to clean the skin that I would be placing the electrodes on. And then for psychologically, I would just make sure that I explained to him the kind of sensation he would expect to feel, especially if he never had e-stim before. And then if he kind of still felt apprehensive about it, I could demonstrate it on myself, just make him feel more comfortable. And so then after that, I would want to prep my equipment. So I would turn on the e-stim unit. And then I'm going to be using a bipolar application technique, which is 2 electrodes that are of equal size. I would attach them to my leads and then attach them to the skin. I just want to get right in that muscle belly, and then at its distal attachment. And I'm also going to put tape on them, just make sure it stays over the wires. Okay, now that my machine is on, I would be selecting electrotherapy, and then I'm going to select Russian. And then I'm setting the cycle time for 10 seconds on, 30 seconds off. And then my burst frequency is at 50 pulses per second. This is for muscle re-education for his chronic injury, because it's been about 4 months. And so this is going to go on for 20 minutes. And I'm also going to give him a dumbbell. This is just a light dumbbell. I could increase this dumbbell over time after he received multiple treatments. But to start out, we're just going to do a light dumbbell, and then I would increase the intensity, and I would keep talking to my patient, and he would tell me when he started to feel it. And then I'm going to wait to see this contraction, and when I see a contraction is when that's my cue to stop and begin the treatment. At 4, at 5, at 6, at 7, 8.8.
What's it at?
Is that 10? It's 11. Do both.
Are you still upping it?
Uh-huh.
Do 11.5.
Okay.
What's it at?
12. 12.5.
What's it at?
14. Okay, now I see the contraction. And so I would start my treatment. And then since he has this dumbbell, every time that he feels a contraction, and it'll be 10 seconds on, and he's just going to do a pectoral dumbbell fly, and he's gonna hold it in isometric contraction, hold it for 10 seconds, and he will relax for the 30 seconds that it's off. So I'm gonna start my treatment. It's for 20 minutes. So he would contract, and he would hold it for 10 seconds, and then once he felt that muscle release, then he could slowly relax. And then I would just keep talking to him, making sure that he was feeling okay, and then if I really wanted to monitor him, I could stand here and I could get him ready for when I saw on the screen that it was about to contract for him. Okay, contract. And relax. Okay, so we can pretend that for this video, we can pretend that that was 20 minutes, and then because of the stretching window, I would want to quickly begin my massage. So I'm going to clean up my eStim equipment, and then begin massage with him. Okay, so for massage, I would want to pick effleurage, petrissage, and vibration, just because of the type of injury and like with the location. So for massage, some effects and benefits of massage that increases venous return, it increases relaxation, increases blood flow, and then it can break the pain, spasm, pain cycle of the body, and because of this, it can decrease his pain. So I would do this for about 5 minutes, and I would let him know what I was about to do and make sure I had good consent. And so first, I could use massage oil or massage lotion, or I couldn't use any at all. But first I would just lay hands on him for a little bit, and I would feel him relax if he was a little apprehensive to my touch, and I would slowly talk to him, making sure that he was comfortable the entire time. And after that, I would start effleurage, which is just light stroking. And then I could move on to petrissage, which would be just kneading and just like lifting the skin. And then I can move on to vibration. So I could just take his arm and just loosen up that area. So I would do this for about 5 minutes, 5 to 10 minutes. And then I wouldn't want to do this on acute injuries. This is a chronic injury. I also want to do it over any fractured sites, if they had any lesions, or if they had hypersensitivity in that area. I would just want to avoid massage. But because this athlete has been having issues with his strength and pain in this area for about 4 months, then I would hope that this would work out for him and he could go on about his practice and have an improvement.